Well, thank you everyone. Thank you, Susan. I always love when she introduces me because I always feel so much more important about the things that I do, and my existence just seems to make sense. As Susan mentioned, my name is Samuel Hickson, and I am the Research Assistant and External Affairs Liaison for the Office of Clinical Research here at Cleveland Clinic, LouRuvo Center for Brain Health. And I'm here today to talk about preserving memory, clinical research in the 21st century. Now, why is that important? Why do I want to tack on 21st century at the end of that phrase? Who cares if it's the 21st century, right? The reason is because research, especially clinical research in the United States, has a very long and very dark history. And today, I am here to clear up any misconceptions you may have about research and what we do here at Cleveland Clinic. Every sound, every sight, every taste, every smell, every experience, whether it be wedding dates, the birth of children, birthdays, all of that is a memory that each and every one of us would like to preserve at some point in our life, right? Am I wrong? No? We all have memories that we try to hold on to, for better or for worse. But what if, through no choice of your own, you were forced to forget? What if something or someone took away your right to remember who you are? And remember the person that you love. Remember the name of your child. What would you do? Would you sit there and let it happen? Would you sit there and give up? Or would you fight back? Today, ladies and gentlemen, I'm going to talk to you about an opportunity that you have to fight back and say, no, this will not become my life, and this will not end my life. This will not take away the memories that I hold dear and near to my heart. And that, ladies and gentlemen, is clinical research. Here at Cleveland Clinic, although I will be talking predominantly about research in Alzheimer's disease, we conduct studies in a number of different areas. Not only do we conduct research here in Las Vegas, but our partner sites in Cleveland, Ohio, Lakewood, Ohio, Weston, Florida, also conduct research. And we conduct research in the areas of Alzheimer's disease, which I'll be speaking predominantly about today, Parkinson's disease, Huntington's, and multiple sclerosis. Now, why is this important? Again, the question, who cares? Because for most of you, you've pretty much lived a very long and bountiful life, we would hope. So why? Why is it important that we conduct research in Alzheimer's disease? Let me give you some statistics, okay? Today, there are nearly 5.5 million people in the US living with Alzheimer's disease, and it is also the 6th leading cause of death in our country. It costs us annually about $172 billion to treat this disease. There are roughly 10.9 million unpaid caregivers dealing with this disease. Think about that number, 10.9 million unpaid caregivers facing this disease day in and day out. And that, ladies and gentlemen, is why it is important that we conduct research to end this disease, because no one should have their life stripped from them. No one should be forced to forget who they are. So again, why is it important? Why can't we just give up and say, you know what, I'm 85 years old, so I've reached my life, the end of my life, I'm good. Why is it important? Well, there are a number of different things. As Susan mentioned, there is no cure right now for Alzheimer's disease. So once you get it, you have it, and it's going to stay with you. Clinical research is the only way we have to find new treatment modalities, new testing modalities, new medications to end this disease. Additionally, it gives you a more active role in your own health care. Some people may accept sitting back and letting this disease take its course. But let me remind you that 1 in 8 people over the age of 65 will develop this disease. And as you go over 85, 1 in 2 people will have Alzheimer's disease. So what does that mean? That means by 2050, over 100 million cases will have Alzheimer's disease in the US. Okay, 100 million people by 2050 will have Alzheimer's disease. Every 70 seconds, someone is diagnosed with Alzheimer's disease. So you have the opportunity to get the world's best health care by participating in clinical research. Additionally, you gain access to potential treatments before they are widely available. Here at Cleveland Clinic, although we do test treatment modalities, we also test drugs that have not been approved by the FDA. That's new ideas, new concepts, new imaginations, if you will, for the development of new drugs for the treatment of this disease. And you, by participating in research, get first access, whether it be testing a new PET scan, whether it be testing a new device, whether it be testing a new drug, you have first pick before anyone else in the world. And additionally, you can help future generations. Might I remind you that some of you in this room have children, have grandchildren, have great-grandchildren. If you've ever seen this disease in action, you know what it can do. So think about your future generations if you're online, even if you don't want to help yourself. Think about your children and your grandchildren. Do you want them to suffer the same fate that you've seen others suffer in dealing with this disease? So although I am only talking about Alzheimer's research today that we do here at Cleveland Clinic, I do want to let you know that, as I mentioned before, we also conduct research in MS, as well as Parkinson's disease and Huntington's. You can find information about those trials on our website, and this is a listing of those. Some of them we're going to go in great detail today. If you have any questions, please feel free to let me know, and I'll be more than happy to answer them for you throughout my presentation. And at this time, I would also like to welcome Carson City and our family members there in Carson City, as well as acknowledge that if they have any questions, they can feel free to let me know as well. So the first study I'm going to talk about is Avenir. How many of you in this room have ever dealt with someone who has Alzheimer's disease? Now I want you to raise your hand really high so I can see, because I'm not as young as I used to be, okay? So you know that part of the progression of Alzheimer's disease is that our loved ones typically tend to develop behavioral disturbances. So they shout at you for no reason, they scream, they yell, they hit, they wander, wake up in the middle of the night and eat for no apparent reason. The question becomes, how do you treat this? Do you put them in a nursing home and say, you know what, good riddance to you, I'm done? No. You find new drug modalities, and one of that is through a study called Avenir, which is currently testing a drug called Nuedexta. Currently, Nuedexta is approved to treat a condition called pseudobulbar effect, and now we are looking to see if it has any benefit to those who have Alzheimer's disease. That is another reason why I've titled my presentation today, Preserving Memory, because we're not just about looking to the past, we're about looking at the present, seeing what exists, and seeing if we can adapt it. Now, this particular study is approximately 10 weeks, and it's going to be a 3 to 4, what we call active to placebo randomization. That means 3 people will receive the active drug, 4 people will receive the placebo. Overall, we're looking for a total of about 20 people in this study, so about 17 are going to be receiving the active. About 17 people will be receiving the active drug. Now, I remind you that all of our studies here are double-blinded, placebo-controlled. So we don't know who's receiving active drug, we don't know who's receiving placebo, but that's the beauty of research, because it helps us to determine, does this drug have any effect? And the way we do that is by creating a control that's using a sugar pill, basically. Okay. So here's some of the inclusion criteria. We're basically looking for males or females that are aged 50 to 90 years of age, because we understand that Alzheimer's begins in your 50s, or early onset will begin in your 50s. Could you possibly develop it earlier in your 40s? That is possible, but this particular trial is looking for people between the ages of 50 to 90. You have to have a diagnosis of Alzheimer's disease. So just because you forget where you put your keys every now and then does not mean you have Alzheimer's disease, because it happens to all of us. We need you to see your neurologist, and we need your neurologist to say, we think you have Alzheimer's disease. With this particular study, as I mentioned, it is looking to treat behavior. So we're looking for those people who scream for no reason, who punch you for no reason, who wander for no reason, or wake up in the middle of the night for no reason. Additionally, they can just pace back and forth. That would be a good candidate for us as well. And we need someone who has a caregiver, son, daughter, friend, neighbor, that spends at least 3 times a week with them. This is one of my favorite studies called Nuedexta, because it tests a device which is novel for us here in the US, because we typically test drugs. Now, how many of us in this room only like popping pills? You can raise your hand, don't be embarrassed, because I know we all take an ibuprofen every now and then. But this particular study is testing a device which has not yet been approved here in the US for the treatment of Alzheimer's disease, but it has been approved in other countries, particularly Israel and England. Now, this chair uses a technique called RTMS, which stands for Repetitive Transcranial Magnetic Stimulation. Really big words for us to say that we're going to send impulses, magnetic waves, into your brain to give it a little bit of a massage. Now, that's the very gross simplification of this trial because it does a lot more than that, but that's the easiest way to understand it. In addition to that, this trial will utilize cognitive training. So while you're sitting in this chair and hearing all the noise and getting the magnetic massages, what you're going to have is a computer screen in front of you that has a number of different tests that you're going to do, almost like playing a game. But again, there is what we're calling a placebo or sham treatment to this study. So not everyone's going to be receiving the active stimulation. Some people may receive the placebo as well. Now, what is different about this trial is that it is 6 weeks and you're required to come every day for 1 hour, with the exception of the initial part of the study where you have to be tested and you have to go through the steps to make sure that you can go through it safely. And again, as I mentioned before, there are some mental exercises. So overall, you're looking at a total of around 30 clinic visits, Monday through Friday for 6 weeks. The next that we're going to talk about is Nourish, and I realize I'm going through this a little bit fast, but I do have a very special guest that I want to get to. So the next study we're going to talk about is Nourish. Again, Nourish is a reinvention of a compound that is already on the market for the treatment of Alzheimer's disease, but we're reformulating it to see if it can be better. Now, this is a medical food supplement, which means that you can take it with yogurts, with milk. Additionally, it's looking for people who have mild to moderate dementia. Now, to you, that doesn't really mean anything, but to researchers, it does. So again, we're looking for people who have a diagnosis of Alzheimer's disease, ages 66 to 90. Now, with this particular trial, you can have a CT or an MRI within 18 months prior to screening. If you've never had one before, it's okay. We can do that for you here. Additionally, this study duration is 26 weeks, followed by an optional open-end or open-labeled extension, meaning that everyone would be receiving the active drug. So before I move forward, I want to ask, does anyone have any questions at this time? Yes, sir.
The study with the chair, do you also have to have
Alzheimer's disease? Yes, the question was the Nuedexta study, do you have to have Alzheimer's disease? Yes, you do. For the majority of our studies that we do here, you have to have a diagnosis of Alzheimer's disease. I will talk about 2 in which that is not the case, but for the most part, yes, you have to have a diagnosis of Alzheimer's disease. Same question. Any questions from Carson City? Okay, so we will continue on. The next study that we're going to talk about is called Expedition 3, or the Lilly study, as I like to call it. It is testing about 400 milligrams of a drug called solanezumab, and it's a 1-to-1 ratio, meaning that there's going to be a 50-50% chance that you're going to receive either the active drug or the placebo drug that we talked about, that sugar pill that helps us to determine whether or not the drug actually works. There's going to be about a 30-minute infusion given every 4 weeks for approximately 76 weeks. So what that means is every month you're going to come to our facility and we're going to give you a needle in your arm, which is fun, it doesn't hurt, I promise, for 76 weeks, okay? The inclusion criteria, again, to answer that previous question, yes, this one is also looking at those who have Alzheimer's disease. We just love Alzheimer's disease here. We want everyone who has it so we can cure it. With this particular study, we're looking for those who have mild Alzheimer's disease. Again, that doesn't mean anything to you, but to us, it does. You have to be male or female, right? We're all going to be one or the other. And you have to be between the ages of 55 to 90. Additionally, this is going to require the lovely assistance of our pet nuclear medicine technologist, Elaine Pinsky, because you will have a PET scan so that we can determine whether or not you have any amyloid. Again, it's a lot of scientific mumbo jumbo to you, but to us, it's going to determine how best we can help you, and we're going to utilize a lot of Elaine's time to do that. So thank you, Elaine. Additionally, we're going to have some exclusion criteria. So we just don't accept everyone, because here at Cleveland Clinic, we do have a patients first philosophy. What that means is we want you to walk out of these doors the same, if not better, than you did when you walked in. So if you have metal implants or anything like that in your body, I'm not going to stick you in an MRI machine and watch you bounce up, right? Because we don't want that. We don't want you to get injured. So we want to make sure that you're safe. And part of that is by excluding those that could have potential risks to themselves. So with this particular study, if you don't have a reliable caregiver, that means you don't have a sister, brother, mother, father, daughter, son, neighbor, best friend who can come with you to your study visits, unfortunately, you will be excluded from this study. Additionally, there is a condition called vascular dementia. If you have that, we will exclude you as well. We really are looking for those that have dementia of the Alzheimer's type. And if you have any allergies to humanized monoclonal antibodies, we're going to exclude you as well. So those IV injections that you get, we want to make sure you don't have any allergies to those. Next, to your question, and your question here, lovely lady in the colorful jacket, we do have studies that are for those that do not have Alzheimer's disease. Again, it's why I've titled this study about research in the 21st century, because we're not just looking to the past, but looking to the future. And part of that is by looking at people who do not have Alzheimer's disease. One of those studies is called A4, right? Really short. We wish it were that simple. But that stands for anti-amyloid treatment and asymptomatic Alzheimer's disease. How many of you in here just had your head spin by having that said to you? Right? So that's why we're going to call it A4. Now, this particular study is looking at the same type of drug that we talked about for the Expedition study. It's looking at a drug called solanezumab. Again, it is given by infusion. So for those that don't like taking pills, I have an alternative for you, because we can stick you with a needle instead. And it will be for about 164 weeks, a very, very long time it seems like, but it will basically last for about 3 years and 5 months. And again, because we're looking at prevention, we want to see if we can stop other people from suffering the same fate that you've watched your loved ones or your parents suffer. So who are we looking for? Again, right, before we talked about Alzheimer's disease, now we're kind of done with those people. We want to look at those that are a little bit normal, right? So what is normal anyway? For the purposes of this study, we're looking at those that are at a high risk of cognitive decline but have not been told they have Alzheimer's disease, okay? And we're going to determine that by using, again, Miss Elaine Pinsky, and utilizing PET scan to determine if you have any of that amyloid, okay? So again, for you, that really doesn't mean much because it's big words, a lot of scientific mumbo jumbo, but to us, it makes a lot of sense and it will help you in the long run. Additionally, we're looking for males and females. Again, you're going to either be one or the other, so you don't have to worry about meeting this criteria with the exception of your age, because we don't want you to be 35, so all of you in this room are excluded, because we're looking for people aged 65 to 85 years old. And again, we're going to be giving you a PET scan as a part of the screening process that will allow us to determine if you have any of that amyloid that we're looking for. Again, tomorrow, no, it is not spelled incorrectly before you ask. That is actually how you spell the name of this study. So I know some of you are thinking that I'm not grammatical, but I can promise you it is the way that you spell it. And the reason it's spelled with 2 M's is because we're predominantly focusing on a gene called TOM40. I bet you a lot of you didn't know that there are genetic factors to developing Alzheimer's disease, and this is one of them. So again, we're looking at prevention here because we're looking to those that are normal, whatever that might mean. This study is seeking to learn more about the earliest stages of Alzheimer's disease. So we're looking for those that have, again, not been told that they have Alzheimer's disease, but at a pretty high risk of developing it because you've had a mother or a father that have had it as well. Worldwide, we're looking at about 5,000 healthy participants. Again, whatever healthy means to you, we're going to take a look at that definition as well. And here at Cleveland Clinic, we're looking for 120 participants, which is probably by far the largest study that we have done here at our site. So we're going to look at some fun facts about tomorrow. Yes, research can be fun besides getting to poke people with needles, because we're looking for 3 factors. 1, we're looking to determine if you have an APOE gene. We're looking to determine if you have a TOM40 gene, and we're going to look at your age. So for those of you that like to use L'Oreal or all of those other cosmetic products that make you look younger than you are, you might want to hold off on that so I can determine your real age, right? Because some of you look really good. So I'm questioning if you're really 65 to 85. So who can participate? In this particular study, we're looking at those between the ages of 65 to 83. Again, all of you are excluded. And we're also looking for those that are in good and physical and mental health. So we really can't accommodate at this time those that suffer from clinical depression, bipolar schizophrenia, anything like that. And we also want to make sure that you are safe again. So we want to make sure that you are ambulatory and in really good physical health, and that you do have a project partner. So project partner and study partner mean the same thing. Basically, we're looking for someone who can come to all of your study visits with you. This is a very long laundry list of those that cannot participate. As I touched on, we're looking for those that don't have any cognitive impairment. So if you do have any troubles with your thinking, you may be excluded from this. Any other dementias, Alzheimer's, vascular, anything like that will exclude you. Again, as I mentioned, any type of mental disorders that are exclusionary for our study, we're going to exclude you for that as well, and a host of other different things as well. So now, I'm very delighted to introduce a man that I have heard great things about. A man who has been on both sides of the fence because he was a participant himself and then became a study partner to another person. Someone whose story I hope will inspire all of you in this room to think seriously about your participation in clinical research. His name is Mr. Randolph Randy Bolsinger. And before he comes to the podium, I want to again open the floor to any additional questions you might have before he gets up and presents his wonderful journey through clinical research. Any questions? Yes.
Sam, does insurance pay for most of the tests or most of the research?
Good question. The question was, does insurance pay for most of the research? Actually, we don't charge insurance at all. All of our studies are covered by our pharmaceutical sponsors or grant funding that we have for our studies that we initiate ourselves. So we do not charge your insurance. If in fact your insurance does get charged for any reason while you're participating in the study, we do have my wonderful boss who's sitting in the back who will handle those for you and try to figure out where the breakdown happened. But typically, no, we do not charge your insurance.
Now, is that for just Alzheimer's research or like Parkinson's as well?
Again, good question. So follow-up, is it for all of our trials or just for Alzheimer's? It is for all of our trials. We do not charge your insurance for any participation in research here at Cleveland Clinic. Yes?
Some of these trials, you had to have a PET scan or MRI or something beforehand, or she'll give, this lady here will give you one. Is that also paid for?
So the question is, the scans that are a part of our research, is that paid for? Is that correct? Is that what I'm understanding? Yes, everything that is associated with our research studies is covered by the funding we receive by our sponsors and or grant funding. So again, as I mentioned, we do not bill you directly for anything. So we will, first of all, make sure that you are safe to go through our studies, and then our sponsors will cover the cost of your scans. If for some reason you get charged, again, my bosses will handle that. Mm-hmm. Yes?
My husband had that new super high-powered PET scan October year and a half ago. So if they want him to have another PET scan, that's not going to be billed to us, because that super one was on our name.
Right. If he has to have a PET scan as a part of our studies, he will not be charged through his insurance if he is a part of our study. So if he's going through the screening. Right. So if he has anything dealing with Dr. Cummings for clinic purposes, of course that's billed by your insurance. But if he's a part of research, he should not be being billed for any scan that he receives as a part of the study. Okay. So thank you. I will be opening up again for more questions at the end, but at this time I would like to introduce Mr. Bolsinger to come up and share his story.
Well, I'm here to reinforce everything that Sam had said, but we're going to talk in terms of a personal level here. Marty, my wife, and I want to encourage you to think about being part of any clinical trials that they have going on here at the Cleveland Clinic related to any of the diseases that you may be dealing with. What we were asked about to talk today, and the reason we're here, is to tell our story and what we've done here with this clinical trial. Also, we're going to be talking about. We've been rejected from some of the clinical trials, and we'll tell you our reasons and things behind that. Now, I also wore this hat special today, not just to cover my head, but I'll explain at the end why I have this hat on. But first of all, I would like to tell you about, I want to bring this to a personal level and tell you about my wife, Marty. Just recently, her diagnosis was from MCI, memory cognitive impairment, which was changed to Alzheimer's. When she retired, she was the CEO of a large nonprofit organization that had a huge $55 million budget. 3 years, this organization was picked in the San Francisco area as one of the best places to work at. She was listed, and I brought, just to confirm this, I can say anything I want, but how do you know that what I'm saying is true? She was listed as one of the 100 most influential women in business today, and this is her plaque that we have hanging on the wall at home. If she needed to talk to the mayor of San Francisco, who was Willie Brown at the time, they opened the doors to let her in. She raised millions of dollars to serve kids and families within the Bay Area. She was the first woman in this national organization that started at the ground floor and worked her way up into a major metropolitan association as a CEO. She still is a mentor to many women within this organization, and it's predominantly a male-dominated organization today. Now, I say this because I know her story is very similar to your story and the success that you or your loved ones have had in their careers. When we retired, we were asked by our national organization if we would start and head up an executive coaching program for the national organization that we work for, which we did. And what we've done is we've trained over 50 successful retired CEOs in this organization on how to be executive coaches. And then we've matched them with new hired CEOs in this organization throughout the United States. We've been doing this for 7 years, and now in June I'll be turning this program over to someone else because the last couple years Marty has not been able to help at all with this program because of the disease. And more of my time, of course, is being spent being a caregiver to her, and so I've had to give up, and we both have had to give up some of the things we've been able to do. This disease has changed our lives, our retirement plans, our day-to-day interactions. And I know with you that are dealing out there with it, you can relate very strongly to this. This disease has taken this outgoing person, a leader, a wife, a great cook, which now I'm having to learn to do that, and has turned everything almost to be the opposite of what's going on. However, I have to say, her attitude is that she's going to fight. Our hopes and our prayers is that she can stay where she is for the longest time, whatever that may be. Now, to fight this incurable disease today, we have kind of looked towards the future, and if it's not for us, it's for you and it's for our kids. When we were asked if we wanted to participate in the clinical trials, we said yes, because we know there will come a day where there's going to be a cure for this disease. Recently, a friend sent me an email. They send several emails. Sometimes I just hit the delete key. Sometimes, you know, there's some very interesting things. We all have those friends out there, right? Things. We sometimes wonder, boy, what do they do with their day? You know, they come up with all of this stuff. But this one was kind of interesting, and I pulled 3 quotes out from this and the reason I put these in here is because this is one of the reasons why we believe that there's going to be a cure someday for this. Quote 1, everything that can be invented has been invented. This was said by Charles Duell, Commissioner of the U.S. Office of Patents in 1899. Just think if everyone believed that, where we would be today. Second quote, "The abdomen, the chest, and the brain will forever be shut from the intrusion of the wise and humane surgeon." This was quoted by Sir John Ericsson, British surgeon, appointed Surgeon Extraordinary to Queen Victoria in 1873. Now, the one that we can all relate to in the last quote here is that there is no reason anyone would want a computer in their home. Ken Olsen, President, Chairman, and founder of Digital Equipment Corporation in 1977. Do we believe there will be a cure? Absolutely we do. We know that in Marty's case, this disease, and you heard some of the things going on here, they're close to identifying predictors for people early on or could be susceptible to this disease. We know that they're developing medicines today that will help slow down the disease. So we believe there will be a cure. Marty and I, and hopefully those who have been involved in clinical trials, would like to believe that in some small way, we had a part in this cure. And maybe the next trial we participate in may be the one that's going to slow down this disease and extend our life together to continue to enjoy the things that we always wanted to do and be. Now, Marty did participate in this transcranial magnetic stimulation. And as Sam said, it was a 6-week program every day for 6 weeks except weekends. These are some of the photos where I was able to shoot while they were getting Marty ready for this magnetic stimulation. The chair kind of reminds me of Captain Kirk in the Starship Enterprise that she sat in. And then once they got her all hooked up, it was sort of reminds me of the Frankenstein movie where they had Frankenstein all hooked up before they pulled the switch and things. Now, I wasn't allowed to stay in the room while she was going through the test, and he did explain some of the aspects of the test where she had to sit very still for an hour while they did some kind of stimulation, and she had to answer things on the computer screen. As it was mentioned, this study is used in other foreign countries where they have found that it helps with them in their cognitive remembering and not having decline. They also found when they stopped using this that there was a potential that their cognitive skills did decline. Before the United States will accept this as a treatment, they need to do their own studies. Fortunately, this is one here at the Cleveland Clinic, and there's a couple other places, my understanding, that they're studying this across the United States. Now, while sitting in the lounge there every day for 6 weeks for about an hour and a half and stuff, out came some people doing a study for Parkinson. And they came up to me and they said, we need some normal people to establish some baselines for a Parkinson's study. I looked around the room and I was the only one sitting there. I said, who, me? You know, my wife may have disputed that part there in our history, but I did. And mine was very similar. I didn't have to sit in a chair and things, but they found a spot in my head where they did this stimulation that would create my hand to jump. And while they were doing that on a computer screen, I had to squeeze this little thing and follow this line. It went like this up and down and around. I had to try to stay with that. There were some other motor skills I had to do, like putting little round pegs in a hole, like the little cribbage thing and stuff. Of course, my competitive spirit came out, and I said, what's the record on this? You know, and I'm trying to hit the record and move cans and put things in and things. So it was fun to do, and I was glad that I could be some small part of this and helping in the Parkinson's study. Now, Marty was going through some other tests recently for a drug study. Everything was looking good until it came to the cholesterol level. All right, her cholesterol level was a little bit high. Not high enough that our family doctor says you need to go on a cholesterol-lowering drug, but because of this drug study, it was going to raise the cholesterol level, and they didn't want it to go any higher than what it was. So we've had our family physician put her on a small dose of cholesterol medicine to bring it down. We're hoping that if there's still openings in this study, and just yesterday we got the results that her cholesterol level is down, that maybe we can get into this study. She was rejected from another study just because of some other medication that she was taking. My point in this is that in these clinical trials, the physicians know what they're doing, and they're not going to do anything to you or us that is going to increase your risk for what they know about the drug or the study that you're going through. Now, I've given you some reasons why we're willing to participate. If we do nothing, nothing happens. But just maybe, and that's our hope, just maybe, the next study that we may participate in may be the drug that will delay this disease and give us more time together. Our experience here at the Cleveland Clinic has been very professionally handled. From the documentations that we get, and you read through it, and those packets are pretty thick and stuff, they're very informative. They tell you what all the risks are. To the volunteers who meet us at the counter, you know, and escort us in, to the medical staff that administer these trials and things, and to the medical professions who care about what's going on. And I also have to mention, since I sat in the lobby where the two ladies are that answer the phone in there, and I told them, I said, you guys just do a great job in answering the questions and the patience they have, because you listen to the conversations like, my God, why did that person ask that question? That they have in answering and dealing with the people that are calling into the Cleveland Clinic. I guess at this point, if anyone has any questions about what we're doing I kind of conclude some things on here, I'd be glad to answer them. But one question you may have is that when Marty completed this one study that she had, what did I notice during the study? And during the study, I can say she was very happy, all right? Did I think her cognitive skills improved? I couldn't tell. And we were not allowed to know the results of the study that was going on, if she did or didn't improve. But she was happy, and I think she was happy because she knew that she was contributing. And I believe that had a big impact. Now, I can say that after the study, and it took many weeks, there was a decline in her abilities. That has seemed to level out over the past month and a half right now, so there really has not been any changes there. How many of you are thinking about being in a clinical study? Is anyone?
I've done it.
Have you done it? All right. What barriers may be keeping you from making that next step, other than not meeting the criteria for the Cleveland Clinic? Yes.
I have an aversion to taking drugs.
Okay.
And so it's a little curious to me why you would take more drugs, as you explained that Marty was put on drugs in order to bring her cholesterol down, in order that she could be part of a trial study. So from my vantage point, when I'm so against that thought, I'm just curious as to your thoughts so that I might understand it.
Okay, the question is that I have an aversion to taking more drugs, all right? And I can understand we've never been the pill takers throughout our life. Where we are right now, there's no cure for this. It's only going to get probably worse over time, just historically speaking. Hopefully it doesn't, okay? What do I have to lose at this point in her taking more drugs? As I said earlier, the hope is that maybe this drug that we're using in the clinical trial, we don't know if it's the placebo or if it's the real thing, may be the thing that can prolong our time together, that we can still communicate. And to me, that risk at this point is worth taking with that.
Thank you.
Any other questions or concerns? All right, just in conclusion here from this for us is that, to summarize why we're involved here, gives us hope, all right? For maybe this disease does not regress. The second thing, it encourages her, all right, that she's part of a cure. And that's still the fighting spirit that I see in my wife, Marty. And our belief is someday that there will be a cure for this. And when they do, you, your kids, your grandkids, and ours will not have to go through what we're having to go through today. And the last one is that we are in good hands of caring professionals here who watch us closely and also want to find a cure for us. So if you qualify, I say do it. Now, one of the things I said at the beginning, the reason I wear this hat had nothing to do with the Cleveland Clinic, but we also support Ride for Kids, which is the pediatric brain tumor thing, which I know impacts this. We help with the MS 150 when they were doing the bicycle race. A couple weekends from now, we'll be doing the Tour de Cure with the Diabetes Association. So not only do we try to participate in the study itself here that the Cleveland Clinic will offer for the trials, but also we're helping out there for other organizations that want to find cures for some of these diseases. So if you qualified, do it. And thank you for giving me the time to share our story too.
I know that many of you in here have aversion to taking drugs, but research is not just about taking drugs. In fact, it's probably the furthest thing from our mind. Our goal in research is to help prolong your life and the lives of our children. So I hope today that you learned something new, and I hope you seriously consider giving additional thought to participating in clinical research. At this time, I would like to open up for final questions, but first I would like to start with our family down in Carson City. Are there any questions from Carson City? So I will open it up to the floor here. Yes.
On the TMS, like on the screen, do you know how well this device works in this situation? Because it does seem to work with migraine headaches. And the FDA's approved the device for that.
Sure. So the question was, the Nuedexta study that we're testing, do we know how well it works for Alzheimer's disease? Is that what I understand? Because it works for migraine headaches. At this point, we are still in the infancy of testing this device, so we don't have any results at this particular time. So unfortunately, I could not answer that question for you, but we do have the study coordinator here who will be more than happy to possibly give some insight, if she can, on what we know to date so far. Okay. Any other questions? Yes.
You're interested in participating in research, who do you talk to?
Great question. The question is, if you're interested in participating in clinical research, who do you talk to? At this time, we do have a 800 number hotline that you can call outside of the facility that will give us feedback on you and who you are and your interests. Additionally, I do have my colleagues here who will be more than happy to answer specific questions about the child that you are most interested in. And I will be here to take additional questions after as well. If you do have others, we'll take one more right now.
What is the 800 number?
Sure, and I do have business cards. So the question is, what is the 800 number? The 800 number is 1-855 Lou, that's L-O-U, Ruvo, R-U-V-O. And I do have informational business cards that have those numbers on it that you are more than welcome to take today. Okay, so if you have any other questions, please feel free to see me. And thank you for coming.